welcome to our She Leads Health LinkedIn Live event. Today, we are celebrating the strength, resilience, and impact of women leaders transforming global and public health. I will share a little about our organization, and then I have a fun little exercise for you. So, if you have a pen and paper handy, you might want to take notes. WomenLift Health envisions a world where diverse, accomplished leaders collectively transform health outcomes. To realize this vision, we seek to expand the power and influence of talented mid career women in health. We engage senior institutional and societal leaders to catalyze systemic change for both gender equality and health leadership. We work in East Africa, India, Nigeria, North America, Southern Africa, and we're continuing to explore outreach to other regions. You could read more about us and our impact at www.womenlifthealth.org. We have an amazing mission. And one of the things that I love most about working at Women Lift Health is that I get to spend every day with so many women. I read about them, I talk to them, I listen to them, I'm in awe of them. I absolutely love women. I think we are powerful and we are so good at so many things we do, but so many of us don't see that. I often don't see the things about myself that others see in me. And don't get me wrong, humility is important. We all have room to grow. But today, I want you to start with what you're good at. I'm giving credit to Angel Kutsia, my colleague, for spurring this idea. Now grab that pen and paper. And don't worry if you don't have it. I'll share the instructions in LinkedIn again. So I want you to begin with a list of 20 things you're good at. Not 10, not 15, not 19, but 20. You're not allowed to stop till you get to 20. You can exceed 20 if you like, but I want you to make a robust list, one that you're really proud of. Includes your technical skills, how you manage, how you inspire, how you speak, how you listen, how you collaborate, how you empathize, how you show up for others, how you include others, how you lead. And these are just ideas. The list of positives is about you. After you finish making this list, look at it and read it out loud. And preface every skill with, I am good at. I am good at managing people. I am good at diagnosing patients. I am good at listening. I am good at inspiring. Read with conviction and some confidence. Believe in yourself. Now think about 3 to 5 ways in which you want to grow. And no more than that. And maybe you can just lean on the 3 side. I want to become better at this. Look at these 2 lists together, what you're good at and what you want to get better at. You'll see the connections between what you already do well and how you want to grow. I promise you will see clearer pathways. You'll see possibilities if you want to take it one step further, reach out to a few people. Not just anyone, but people who know you, people who you trust. And maybe they're also your champions. Show them these lists. They'll probably say, hey, you missed this thing. And they might even say, of course you can do this other thing. You can do this exercise over and over again. When you're feeling low, when you want to apply for a job and you start talking yourself out of it because you can only do 8 out of the 10 things that they asked for. When you want to reimagine a new career, a new position, a new pathway. The point is to remember that you are good at a lot. And you can coach yourself out of that dreaded imposter syndrome because you are enough. Good enough, smart enough, strong enough, more than enough. In the words of the great Nelson Mandela, courage is not the absence of fear, but the triumph over it. And with that, I'm going to pass the mic to my amazing and courageous colleague, Dr. Akhona Tshangela, the Southern Africa Director at Women Lift Health. Over to you, Akhona.
Wow, thank you so much, Shereen. What a way to start our session today. I think that is exceptional. And I hope every woman out there is actually listening and jotting down. I've started jotting down my notes, by the way. And so hopefully by the end of this session, I can also just pull them up and say, this is what I am good at and I am proud of. In fact, start putting sticky notes all over my house and just indicating that I am really good and keep it as a constant reminder. So yeah, thank you, Shereen, for greeting and greetings to everyone. We have our powerful panelists, as well as all the participants joining us from all over the world today. I think it is a very great honor to moderate this session. Really celebrating our remarkable women who are making change in one of our most, it's really one of our most favorite things to do at Women Lift Health is celebrating women. So ladies, and I'm sure, or hopefully, we may have gentlemen listening in. Thank you for joining us. As we celebrate International Women's Day, or should I say recognition, others are even saying we should make it a month. But Saturday was the official day, but I think every day should be spent reflecting and celebrating each other on our overall triumphs and achievements. We are still far from achieving gender equity in public health leadership roles, but most moving forward towards the goal, no matter how small the step may be, I think that is seen as a win. And sometimes we forget that it's not the big steps, it's all the smaller steps that we actually all take to ensure that we are moving towards gender equity. And I think this campaign really is exactly that, celebrating women, such as the women on our panel, who are driving change and transforming health outcomes through their own leadership. Welcome to our panelists, as well as to everyone who has joined us to celebrate and spotlight inspiring stories of exceptional, influential women leaders who, during this session, will showcase their leadership journey so we can learn and grow together. I will start off by introducing our panelists, and they will also introduce themselves. And I think mainly to really highlight what inspires them to be women leaders or what inspires them to continue being such great women leaders. And then we'll go into the overall panel. And so I'll start off with Dr. Jacqueline Kitulu. She is the incoming president-elect of the Women Medical Association. She has over 20 years of leadership health experience, a champion for universal health coverage, ethical medical practices, and resilient health systems. And she has influenced quite a number of policies at national as well as global level. So, Jack, can you please introduce yourself? Tell us what inspires you in 2 to 3 minutes.
Thank you very much, Akhona. And actually, I'm the president-elect of the World Medical Association. It's not the women, it's the World Medical Association.
Oh, well, sorry.
And I am the president-elect. I will be inaugurated later this year in October. I am actually the second African female to be at that position. But I'm also a practicing family physician. So I do see patients. I've just seen patients up to now. And now I'm in this other space. So what else did you want me to say? What inspires me to be in this position? And I think I'm not a complainer. If there is a challenge, I want to be part of the solution. In Kenya, we have this famous term of people being keyboard warriors. They'll go into all social platforms and complain about everything that's not right and not happening. I don't want to be a complainer. I like to be part of the change makers. So if there's a space in which I can get into, I will step into it. And what inspires me really to remain in this space is that we are still such few women in the leadership space, in global health, in national health, actually on most of the senior levels. It doesn't even matter, even if we stepped out of health, we are still very few women in that space. And I think as women, we bring in such variety in inclusivity and collaboration in our leadership style that it inspires me every day to remain in that space and be part of changing those spaces for the betterment of our patients. Thank you.
Thank you very much, Dr. Jacqueline Kitulu. So we'll move on to Dr. Bhavneet Bharti. She is a distinguished pediatrician, child welfare advocate, and director principal of Dr. B.R. Another difficult name to pronounce, Abedka State Institute of Medical Sciences, a 2022 WomenLift Health Global Fellow in India. She spearheaded Punjab's first human milk bank. By the way, I loved your project very much. And if anyone hasn't heard of it, please go in and find it in our YouTube or our website. And a huge advocate for child adoption and fostering. Dr. Bharti, over to you, please.
Thank you. Thanks a lot, Akhona. So I am basically, I would like to say I'm a pediatrician and became an accidental director principal. And this is a new medical college which I started right from the foundations. And this is the fourth year. And this particular medical college had several unsuccessful attempts before I took over in 2020. And currently, after 4 years of my being as a director principal, this medical college is rated as one of the good medical colleges with a lot of academic environment. So my academic environment, which is based on a international dream scale, which I just recently completed that survey, and it is at par with some of the best medical schools. I can't say about infrastructure, but definitely for this. And as a women leader project, my Women Health Lift project, I tried to optimize the breastfeeding ecosystem in my hospital and set up the first human milk bank, which was actually inaugurated by the Rotary International president. It was a public private partnership, and this was a vision born from compassion and driven by science. And it taught me that leadership is not about titles, but makes the system kinder, more humane. In fact, when I started this project, many mothers would come and actually cry when we would just listen to them. So basically, some would say, "What are you doing in this milk bank? The mothers are actually crying." What I said, we're providing them safe space. That's why they are doing it. It's all right. It's all right to listen, and specifically when they have postpartum blues. And I'm the first in my area, the first and the only foster mother for which I was recognized by the governor. Although this is not about recognition, it's about being humanity. So I believe in benevolent leadership, and that's what I feel when empathy, service, and inclusivity guide every decision.
Wow, that's beautiful, Dr. Bharti. Truly inspirational, and we haven't even started with the session. Um, our next panelist is Dr. Orapeleng Phuswane-Katse. She is a public health specialist shaping Botswana's health landscape as the acting district health management coordinator. She's a Mandela Washington Fellow and dedicated mentor. She's committed to empowering young girls and advancing holistic healthcare. Dr. Orapeleng, please, you have the floor. Just tell us who you are and what inspires you.
Thank you so much, Akhona. It's such a privilege to be sitting with this wonderful women. I'm already inspired. I'm currently working as a public health physician at subnational level, and I think it's one of the things that I really enjoy and appreciate because I literally get to work within communities. And I think just like Dr. Kitulu, I get to be in the consultation room and take whatever I do out into the communities. One of my biggest passions that I'm currently working on is trying to deal with malnutrition issues within the region and in my subnational level units. So I think those are some of the things that really, really inspire me and just make my job worth it. Like it's really nice to wake up every day and know that you're going to inspire change and make somebody's life better for that day. What inspires me is literally working with young girls and making sure that they get to learn the power that they have within themselves and being able to know that they can occupy spaces. And I think two of my biggest motivations are my own two young girls. Like I would want them to know that the world is their oyster. They can literally occupy any space that they put their mind to because they saw their own mother do it. I'm still very young in my career, but I feel like I still have a lot to do and a lot to offer. And I think that is one of my other biggest motivations. There's a lot of questions that need answers. There's a lot of things that need to be right. And I think every day I'm looking for those challenges and really wanting to make a change in the space that I'm in. Thank you so much.
Thank you. Thank you, Orapeleng. Last but not least, we have Dr. Lennie Bazira. And she's a public health expert and policy director at the Community Health Impact Coalition, working to strengthen health systems and primary health care. A WomenLift Health Global Fellow as well from North America. She's dedicated to advancing equitable healthcare solutions. Dr. Lennie, welcome, and please introduce yourself and share with us what inspires you.
Thank you so much, and good morning, everyone. Of course, it's a pleasure to be amongst colleagues and women leaders. For me, what inspires me as a woman leader, I have a passion to be able to mentor other women leaders to realize their fullest potential. So right now, at Community Health Impact Coalition, I work with community health workers. They are women leaders. Majority, 70% are women who are being treated as volunteers. And as you can see, I believe in equity. I believe that as women leaders, we will not succeed if we leave other women behind, especially those who are less fortunate than us. When I work with community health workers, some of them are my mentees right now. I see potential in them, and my passion is to continue advocating for them until policies change so that they can actually be professionalized, so that they also get paid. My project during Women Lift Health was about advocating for them to get paid, because I'm originally from Uganda. I was comparing myself as a profession who gets paid and a mother. And I was comparing myself with a community health worker who works, she's a mother too. At the end of the month, I get a paycheck and she does not. And to me, that was not acceptable. So I continue to lead because I am passionate about advocating for those less fortunate than us, so that as women leaders, we can't leave any other woman behind. But also, I have children, a young girl. I want her to look at me and be inspired to lead, but also to care for those less fortunate than herself. But I also don't want to leave the men behind, because I have a young son. My kids are twins. I want him to be a male ally, so that when he's growing up, as he gets into position of leadership, he supports women, including his sister, but even other women, to realize their fullest potential. That's why I continue leading. I want to mentor other women. I want to advocate for other women as we continue to uplift each other, because together we succeed. Thank you so much.
Thank you very much, Dr. Bazira. So welcome to everyone who's joining us on our LinkedIn Live. I hope you really enjoyed the session. We're here to celebrate this wonderful woman already. I hope you've all heard what an inspiration they all really are. And so I'll take the initiative, like Bhavneet was pointing out, remove all titles, and I will start calling you all by first name. I think now we can all celebrate your hard work, and you're all doctors, and congratulations. So moving on to the very first question, and I think I would like to allow you all to really just think through taking us through your journey. We've heard the different barriers just from your introductions, by the way. We've heard the different barriers that have pushed you to be the women leaders that you are. But what would be really nice to also further hear is, can you briefly share a moment, or it could be more than one moment, from your journey that really shaped your leadership approach and impacted your health outcomes? I'll start with you, Lennie, because I think you started around that, talking about your community health workers and the likes. So please feel free. Can you just share, give us a few moments that really pushed you forward into changing your leadership approach?
Yeah, so when I started my career, initially I was working as a doctor in a hospital, like most of us on this panel. But later I realized that the healthcare services were not properly planned, the policies were not right. At that moment in life, I decided I'm not going to pursue a career to become a clinician. I went into health economics because I believed that I could change the policies that could influence healthcare financing. Along the way, I went into managing projects on the continent, maternal health, HIV and AIDS, and everything else. But every time, wherever I was working in different countries, I always worked in the communities. I always relied on volunteers. Those are the community health workers. And I always realized it was not fair. These women and men worked so hard. They were the ARV treatment adherent support team. They were the mentor mothers and so on. So I decided as like, what else, me as a leader with the privilege that I've been given, what can I do to shift that? So when I still worked as a country director, I started like advocating, even then, that in our projects that we implemented, let us pay them, let us support them, let us empower them, let us train them. And then fast forward, when I joined WomenLift Health, I had moved to the US. And as a leader, for me, it was like a wake-up call when Dr. Shereen mentioned at the beginning, take off your mask. I had come from Africa, whereby my career had risen. I was the interim CEO of AmRef Health Africa. And then I came here as a Black woman, an immigrant woman, and things were different. And initially, I started putting on this mask, like not trying to be myself. I have an accent. I was a mother of young kids and I needed to work. So, but then during the journey, the WomenLift Health leadership journey, which I'll forever be grateful, I realized that I can excel at both. I can be a great mother, I can be an excellent professional, and I can be an amazing advocate for other women. I do not have to hide who I am. I have to be my authentic self. I am a believer, I'm a Christian. I said I don't have to hide my faith because I'm in the US. I have to speak about it because that's what keeps me going. Grace keeps me resilient. So for me, those moments, like from a hospital where the policies were not right, working in the Africa, in the communities where I saw the injustice, and then fast forward coming here as an immigrant African woman and realizing that my career actually took a turn. I had to like go backwards, like mid career from executive leadership, but humility kept me going. And the moment I took off that mask, no more imposter syndrome, I am who I am, and I lead with authenticity. I have to believe in my values. I'm not going to compromise them. That has shaped my leadership journey. If I believe in a cause, I will advocate for it. If I believe that I need to mentor other women, I'll lift them up. I do not want to succeed alone because I believe as women leaders, we will change the world if we support each other. So those are the moments that have really shaped my career. And I'm still a journey because my leadership journey is not a straight curve upwards. It has valleys and mountains. But as long as I have the support system of other women leaders and of course my faith, I believe I can succeed and bring other women up with me. Thank you.
Thank you so much, Lennie. And I really love how you summarized it in terms of the holistic approach you've had. You had the spiritual, you have inspiration from other women, and understanding that your leadership journey is not just going to be an uphill, straight curve, but then there'll be mountains and valleys that you need to go through. So thank you very much for sharing that with us. Orapeleng, same question for you as well. Tell us briefly moments from your journey that shaped your leadership approach, as well as if they've impacted any health outcomes. Please do share with us.
Yes, thank you so much, Akhona. I think my leadership journey has been it's like two different shifts from when you're younger. As a young woman, you'd have a lot of support as a leader, especially when you're transitioning and growing up. You would have people mentoring you, you would have people supporting the work you do. And it's always such a beautiful transition when that happens. So I think my aha moment, or something that really shaped my leadership journey, was when I moved from Ministry of Health HQ and moved to the subnational level. Funny enough, this was during COVID-19. And I think I came in as the leader in the district. A young leader who's female, who's young, and walking into a very patriarchal society. And it was one of those things that at first, the leader in me wanted to have a little bit of a back and forth and say, no, things should be this way, things should be that. But one thing I realized very quickly in the leadership journey was that if you don't work with people, things don't go your way. So I think that was a very big lesson, because all of a sudden the shift was like that shield that I always had was removed from under me. And all of a sudden I had to stand on my own and at my own defenses. So I think quickly I looked up, I asked for help. I'm one person who likes consulting and finding out what could I be doing wrong. I learned that in any society really that you want to work with, especially that is very community centered and rooted in their cultures, is to try and get that buy-in, that community buy-in, that this is what we need to do as a community. So I started working closely with the teams on the ground. I started making sure that everybody understands why we're doing what we're doing towards the COVID-19, liaised with the chiefs, liaised with the traditional healers. Everybody was on board with what the plan was. And for me, I think that was something that really changed my leadership journey a lot, because that is where I learned the importance of listening as a leader and not just making decisions. Before, I had everybody think with me, do things with me, and it was very easy. Like I didn't have to think much. I just had to get direction from the people who are already doing things. But all of a sudden, I had to be the listener. Secondly, I learned to fight the imposter syndrome, because I think I was very resistant, because I felt like maybe I'm not ready for this, maybe I don't belong. But that is when I was like, you know what? I think I'm here because I'm capable. So I just have to find within me those strengths that make me the leader that I am. And I continued to look for leadership opportunities. I didn't stop at that just because I felt like I was a leader. Now I'm okay. I kept on asking, I kept on reading, I kept on learning. But I think one of the biggest things for me was learning to get feedback. If anybody knows me, I do not like feedback. But I was like, if I'm going to be in a position where I'm working alongside with a lot of people with different mentalities, different cultures, different attitudes, I need to learn how to take feedback and use it as positively as I can. And I think most of the things that I learned during that time are the things that I still use every day at work. Like every day for me, it's listen, get feedback, consult, and do things. So I think moving to a district that was highly patriarchal during COVID-19, where everybody was unsure of what is this lady going to do for us, it really shaped who I became and taught me a lot of lessons, which I'm still taking forward with me. And I'm still appreciating quite a lot. So I think that was it for me. Thank you, Akhona.
Thank you. And thank you so much for highlighting the importance of working with communities. I think sometimes we forget we stand in our little corner there, forget that we actually have to listen to our communities for us to actually drive change and have proper health impact. You've mentioned quite a number of things that we deal with in our journeys, which is imposter syndrome, really, and trying to fight through that, ensuring that you belong and taking up your space. And so thank you for sharing that. Jacqueline, I'm going to you to tell us the same thing. Tell us your moments, etc., and the impact to health outcomes.
I think for me, a lot of my journey has been in the professional leadership. And I got into the Kenyan Medical Association, where I was elected as the first female president. Now, KMA was in its 48th year. There had never been a female president before. So I got into this predominantly male club, older males, and there was a little, a bit of confusion on how do we deal with this space. The males have done it in a certain way, and then here I come, I have a different way, and I step back. I mean, and goes back to that bit of leading with authenticity. I was almost like, maybe I should be more like the men. I stood back and I questioned myself. I said, no, I can't do that because that's not me. I have a different style. I have a different way of leadership. So let me do it my way lead like a woman because I am a woman. And in that stepping into myself, I think it went a long way to transforming what the association looked like. Because when I joined, it was predominantly male, and all the leadership before had been predominantly male, with a scattering of a few females here as secretary, one vice chair, but predominantly male. So I thought one of the things that I really need to do in this space is also to make space for more women. And I think even just, and that's where the role of inspiration comes in. The fact that I was there, women looked at me and said, oh, okay, we can take up that space. But I also noticed that there were older men that were there and older women. Those are the ones who are more inspired to be part of the association. I said, we have to make a concerted effort to get the younger people into the association, because they're the pipeline, they're the future leaders. So if they're not part and parcel of this journey, where does the association go? Where do the young ideas, they are fun, the innovative ideas, where do those come in if we don't make an effort? So learning from the World Medical Association, I got to establish the Kenya Medical Association Young Doctors Network, and we got to get them drawn in towards the leadership journey. And for me, looking back now, that inclusivity, drawing in those who are marginalized, who are younger doctors, male and female, and even more women into the leadership. I think it has totally transformed the organization. Right now, in the national executive, which has 6 members, 4 of them are female. And the assistant, the treasurer general, the assistant secretary general, and the secretary general all came from the Young Doctors Network, including the CEO. And they are females, they're young females. The sort of demographic that in the past you'd never have thought would be part of the leadership of KMA. And that, of course, transforms the organization into making it vibrant and attractive to the youth. And you can get the youth participating in changing policy, because the association sits at many policy levels. At government level, you can get that into them. But also in the World Medical Association, I also saw another gap when I stepped into that space, and that's a bit where we say visibility matters. You have to put yourself out there for people to know that you are there. You need to occupy. I think in WomenLift Health, we always talk about occupying the space. And when I did get into the association, I realized we're very few Africans in the association. So predominantly European, American, yes, Southeast Asian, very few Africans. And I began to speak up within the sessions. I was new there. I didn't know. I said, but there's nothing. This is a free space. I will speak to what our needs are. And I think part of that, occupying that space, getting to know people, getting to collaborate to bring the African Medical Associations, joined another team of those who had been there before, so that we can grow our voice and speak to what our issues are as Africans. And indeed, that has culminated into my election in October last year as the second African female to be president of the World Medical Association. So for me, I think all those places, leading with authenticity, occupying space, and bringing in what women bring in, that collaborative approach goes a long way to making changes.
Jackie, thank you for taking up those spaces and ensuring that we have representation in every single space for African women out there. Bhavneet, last but not least, please tell me briefly and share moments from your journey that shaped your leadership approach and impacted your many health outcomes.
So, as I said earlier, I was looking after pediatrics, a social pediatrics. So I was professor in social pediatrics, and my work was around lots of marginalized children, doing a lot of child advocacy, and from that role, I moved on to start this new medical school. So that's the first time I started learning how the team stages are there. And when there was a lot of storming, and that's the time I thought maybe this will continue forever. And that's when I read about it, how it goes. And everybody told me, this is going to norm. This too shall pass. So otherwise, and during that time itself, right in the beginning of career, so I was chosen as a women leader by my secretary. So when she chose me, and this 1 year of WomenLift leadership, that's what gave me and enhanced my skill set, whether it was talking about the leadership values, the 360-degree evaluations, networking. So all those things, which really were very useful because I was able to understand whatever was happening. I was able to give names to what is happening. I was telling there's no need for othering. Actually, we had to collaborate with another hospital. So telling them othering is not required. And another, when I was talking to one of my coaches, and I explained how I actually manage myself. I said, I think lovingly about that person. I think that that's all right. So she explained me, what you are doing is actually a Hawaiian philosophy. And this Hawaiian philosophy is named as Ho'oponopono. That means you don't carry that emotional baggage. And I found jealousy is the most difficult emotion to handle. And when I did, whether I'd say thank you, whether I say sorry, so all these points, the phrases which I used, so they were very useful to me. And I did not carry that baggage with me. And whenever there was problem, initially I was cruelly straightforward. So that's what I learned, to be diplomatic. And the most difficult and the worst thing was that my children, whom I was actually taking care as a social pediatrician, they missed me a lot. So they were having more problems. And in fact, when I visited Tanzania, so I was talking about this on the airport, and somebody commented, "May you look after the orphans of Africa also." So that was something which I felt, okay, I can make a difference. And during this period, I felt every student, I will not correct them till I connect them. So I made sure connecting before correcting. So that's how created an environment which was more loving and kind. And I tell all my students they should follow the 10 feet, 5 feet rule, which says that when you see somebody 10 feet far, acknowledge, and if it is 5 feet, then name it. Wave by. Say something. So that's what I keep telling my students, so that the relationship and the environment is more loving and joyful.
Thanks, Bhavneet. And I'm going to reverse it back to you for the next question, because you do highlight some of the challenges we've always mentioned in terms of being a woman leader, which is primarily having the social responsibility, taking care of
Yeah.
family and the likes. And so I'd like for you to expand more on that and tell us, what are some of the challenges you have encountered or seen other women leaders encounter as they lead in the health sector?
So actually, in the health sector, they have lots of structural biases. They are under-recognized. They have lots of balancing acts of personal and professional duties. So I think, as far as that is concerned, I was able to handle with my supportive family. I had my husband who was working 24/7, because it was almost at the same time I had a foster son, and both things were being handled together. But I feel that one of my staff would say that we have children to see, and I could also say that I also have a child, so we need to keep a balance. So that's gradually, in fact, I learned. And moreover, when my foster son would talk about dinosaurs and talk about the stars, the solar system, I would say the world is behind it. And today also, if you can see, I don't know whether you can really make out, today I'm wearing sparrow's sari. So today I was expected to talk about watching sparrows and the joy of an amateur. So I was taking a talk on this and made sure that we have a bigger role, whether it is about the society, conserving nature, and having some hobbies, and do self-care as well. Whatever we may say, it is important as a leader, difficult decisions we have to take, and it's not a very pleasant duty at times, but I feel as a mother, you continue, give quality time to your family, even if it is short duration. So a lot of depends upon some self-care. It is required because you have to sustain it for very long time. These are not sprints, these are marathons. So you have to do it for a very long time. So I feel that's what keeps you strong as a women leader.
Thank you very much, Bhavneet. Orapeleng, I'd like you to expand a bit more on that in terms of what are some of the strategies that you have applied to navigate through any of the challenges that women face.
Thank you so much, Akhona. I think I never doubted my technical skills or my competence as an individual. I think that's one thing I've always been really sure about early on. And that was until I had a family now. Like I had a whole husband, I had 2 children, and I was afraid of excelling at being an employee, but not as a mother and a wife. So very early on, I wanted to find that balance. And I wanted to raise kids who, even if I wasn't there, could feel my love from a distance and know that I care. And when I started my career, my 2 girls were still very young. They're still quite young, even up to today. But one thing that I want them to always remember is that the woman that I am within my community is the woman they get to experience in the home, if not better. And also be like a wife who is not just who comes home and does that. I know like sometimes we tend to take our careers too much and forget the things that build us and give us our foundation. Every time after a stressful day, the people you get home to are your family. They are your stone. They are the thing that you rely on. And I always wanted to make sure that that platform was beautiful. That way, every time I wanted to fly, they would allow me to fly as high as I possibly can because they know I'm always going to come back. So that is one of the strategies that I do. Always keep what matters and what's important very happy. And I think always having to trust in myself and always reminding myself that, you know what, I can do these 2 things. There's no perfect balance between your work and your life. But if you're intentional about it, if you pray about it, if you put your wellness before everybody else, like it becomes it becomes seamless. Even work becomes fun for you because you know this is a temporary thing I'm going to love, and then it's like a back and forth. So I think that is what my strategy is. Keep what matters and what's important very happy and very solid. Thank you.
Keep what matters the most very happy and very solid. That's beautiful. Basically, find your grounding. And I think that is brilliant. So I'm going to shift things a bit and reflect on really, because this is aligned with all the challenges we're currently seeing in the world in terms of funding going down for public health as well as global health. These are opportunities. I just want to say these are opportunities for all of us to step forward and actually take in that opportunity and spear ahead. And I'll start with Lennie, but it's to both Jackie and Lennie. This question is really, how can women leaders remain resilient and focus on the goal for a better health outcomes in these current times? So Lennie, you can start, and then Jackie can come afterwards.
For me personally, the way I would encourage other women leaders out there, because we are all going through the same challenge, is that I call it grace-led resilience. You have to draw back and remember what brought you into this space. What are you passionate about? What are your principles? Yes, funding is going down, but what is this funding for? I believe in community-led solutions. We need to go back and actually become more creative, become more innovative, stick to our values. The communities have solutions. Yes, the funding that we are all used to is going down, but we have resources in the communities that we serve. And if we step back, we can actually draw into those resources. We can empower communities to be self-sustaining. We can be creative. We can look beyond, we are all in global health. However, there are other things that we can do. We can be entrepreneur and we can lean on each other. This is a time for us to even actually support each other. If you are in a position where you can make the change, maybe you are working for a philanthropy, maybe you're in the private sector, this is an opportunity for you to shape on how they do business. But more importantly, for me, I do believe this is the time to go back to the communities. Why are we doing this? For me personally, I believe in the women of improving the health outcomes for women and children. But like we talked about, where the communities where those women live, they do have resources. They do have food, they do have milk, they do have land, but we need us to guide them. So can we go back to those our roots and actually tap into that? Can we become more innovative and support each other? If you're out there and you learn something that is working for your community, share it with, let us share it in our networks. Let us share it on LinkedIn with our it's working in India, it's working in Botswana or Kenya, maybe it will work in Uganda and another country. This is the time for us to actually work together, support each other. And I said at the beginning, I am a prayer warrior, and pray, because God will guide us to where we are supposed to be. Like I said, I'm authentic. I don't shy away from saying this, because anytime I feel down, my God uplifts me. So this is a time where we feel in global health that we are down, but we are not down. This is a time actually to rise up. But as long as you don't rise up alone, when you rise, carry somebody along with you and the communities that we are passionate about. That way, and again, lastly but not least, let us reach out to our governments, because health is a right. And our governments, our leaders, should be responsible for the health of our people. What are they doing about it? They say they want to invest more maybe in defense. Yes, security is important, but health is also important. It's good for the economy. So let us also speak up. I'm an advocate as well, to our leaders to do more for our people and for our communities, actually to demand more from their political leaders for health, so that we can be supported. And lastly, let us support each other as women, because together we will overcome all these challenges. Thank you.
Thank you, Lennie. Jackie, over to you. Tell us, how do you stay resilient in these trying times?
Thank you, Lennie. I will speak to us as individuals, as the person, that these women in leadership also need to focus on themselves. This is the time to focus on self-care and mental resilience, because there are very many people struggling, anxiety, depression. I mean, when you have a job, there's two of my colleagues, husband-wife couple, who are both working in USAID funded programs, which are closed down. That's shattering, what does that do to your mental health? So this is the time that I think self-care is also very critical. And self-care is not just the mental well-being, because that's very important. It's a time to reach out. Many times we sort of stigmatize the sense of seeing a counselor or seeing a therapist. But this is the time, especially in difficult points like that, engaging with your coach, rethinking, in terms of an adaptive lifestyle. Okay, so this has changed. What can I switch to? But that bit is critical. But even your physical health as it is, because these are the points when we'll see people's, blood pressures rising, if they're diabetic, blood sugars going off. So even just the physical well-being. Those are important issues for women leaders at this point in time. Put in time even to just exercise, create groups of people you can walk around with, because safe spaces in which you can share. I know at the beginning of the stop work orders, there were so many people who are so closed up because they're told, do not talk about it, do not talk with anyone. And it just ties you up and breaks you up as an individual. So I think that's critical, the self-care and mental health. But beyond that, I think also the mentoring of other women, mentorship and sponsorship. And I think Lennie has spoken to it. Because this is, those who have been ahead on the journey have probably gone through some turbulent times and have worked through those turbulent times. That's the time for the mentors to reach out to their mentees and lift them up. But also the mentees to reach out to the mentors, how do we work through this journey? For those who are, out of jobs, this is the time for us to sponsor other women. If you're in an organization, and I love on the WomenLift Health platform for job opportunities, so many women going out and saying, there's this opportunity here, there's this one in my company. If you're applying, let me know so that I can speak out for you. Those are the things that you open with sponsorship. You open doors for those who are not able to get in. With the mentorship, you hold their hand and walk that journey with them. So I will not speak to what Lennie said, because she put it in elaborated quite exhaustively. But I'll just finalize with an adaptive leadership and innovation style. And I think those were some of the big things. I think when we did the WomenLift Health Journey, you're wondering, adaptive, wondering why should I adapt? Now it's so clear why one has to be flexible, that when things change, that you have an open mind to look at, okay, this is no longer the direction it was meant to be. And I think at the Women Lift Health, the lift off journey the other day, they were speaking of the acronym BAN, brittle, anxious, non-linear. We're used to linear processes, that everything is going straight that way. This is non-linear, it's incomprehensible. How do you adapt to that? So let's hold each other and support each other in terms of mentoring, sponsoring, and really taking care of self. Thanks.
Brilliant. Thank you for summarizing that as well. I think, ladies, I'm going to ask you one more question, but then what I would love for our listeners and viewers, because they can actually see us, to also give them the opportunity to ask any questions that are like. I've been following all the comments that are being put in here, but I haven't actually seen any questions. So please feel free to ask our panelists any questions that you'd like to hear from them. I'm asking one more question, and then I'll hand it over to you all to ask the next set of questions. So my last question really is, we've heard authenticity, we've heard adaptability, we've heard mentorship and sponsorship, heard self-care, mental resilience, all the key factors that really houses drive. And there's so much more that has been mentioned, and help us really drive to be women leaders and stand tall. This is to each of you, is what, in one word or a phrase, would you share with women leaders to keep them going, despite the challenges that they encounter in their leadership journey? What is that one word phrase? And a lot of brilliant phrases have come out from this discussion already, but we just would love to hear you pull out a bit more, a bit more words of empowerment and a bit more words of resilience to keep us all going. So Bhavneet, I'll start with you, and then Orapeleng, you can follow as well.
For me, the one word is ho'oponopono. Heal, serve, and lead. That's it.
Brilliant. Heal, serve,
Serve
and
and
lead.
lead.
Love it. Yeah, Orapeleng, tell us, what is your one word or phrase that comes from you?
I think the one thing that have always carried me forth has been I am enough and I belong. Because I've never really wanted not to feel like that at any point.
I am enough and I belong. Brilliant. Lennie?
I would say I'm strong, I'm an overcomer, and it shall be well.
I am strong, I am an overcomer,
And it shall be
and
well.
it shall be well. I hope everyone is chanting these, because I already feel inspired, and I'm just sitting here listening to all these women. Jackie, final words. What would you say to us?
Mine is do it afraid. Do it afraid as you lead. It busts that imposter syndrome and lift another woman as you go along.
So, two phrases. Do it afraid and lift other women as you move forward. I think that is also brilliant. And thank you very much, ladies, really for inspiring us and taking us through and actually opening that door for us to actually learn more from you in terms of how you deal with all the issues that I feel most of us women actually go through in the workplace, and challenges, not just the workplace, because those also go to our communities as well as in terms of our societies and families. We have a question from Judy Home, which is a very interesting one. I'll allow anyone to respond to this one, because it's actually not within, it's not woman related, but it is health related, which I think it is an important question to actually reflect on and respond to. How important is the connection of climate change to patients' health? And how can we do more to move forward? I'll allow any of you to take it on. It is a quite interesting question. How important is the connection of climate change to patient health? And how can we do more to move forward? So the intersectionality. And when you're thinking about just women and how they are the most vulnerable, women and girls are most vulnerable in climate, in terms of climate change. I'm not going to respond to the other question myself, and I'll let Orapeleng respond
Uh,
to it.
I I think I like the question because I've been toying at a PhD thesis around climate change and malnutrition. And I think it's largely because I live in a very arid area and it's been quite hot, hotter than normal, 44 degrees Celsius. And this led to a drought. And with that drought, we had a large number of kids who were now able to eat from the land, not do that. So we had to implement a lot of programs, direct feeding program, give more food rations so that kids could eat, because like the climate was just not allowing for food to grow anymore. And then on the other hand, while we were dealing with that, we had the worst rains we've had in years. And what that did was displace people a lot. People who were on CD meds, people who were on ARVs, like everybody was literally pulled away from their norm and comfort. There were no follow-ups. There was not a lot of things. And I think during that time, we realized that our health system was not resilient enough for climate change, because these are all the effects of climate change, because you've never seen such extremes. So I think as health, we need to now start integrating the effects of climate change into how it could possibly impact negatively towards the health outcome of our populations. And I think you said it rightfully. The people who are mostly affected is women and children. Women mostly because they are the ones who are the caretakers and they're left with kids, they're left with grown-ups most of the time. So they have to deal with following up, trying to make sure that things are done well. So I think we need to introspect and start integrating climate change in how we offer healthcare services and prepare for it, really, to say, should it happen, we are ready to do this, because we were running helter-skelter looking for NCD patients, looking for this one, trying to make sure that people were fed. So it's a really, really pertinent and very important question.
Thank you, Orapeleng. Beautifully responded to. Bhavneet, would you like to add to that?
What I would say is definitely we need to, when we're talking about climate, we're talking about greener healthcare practices, we're talking about supporting policies, community actions, and foster some intersectoral collaborations. It's about having sustainable development goals in practice to make sure that, because in part of the world where we are facing problems is because of the vector-borne diseases. There has been a rampant increase in dengue and the other related issues because of the climate change. So it is affecting the health, and we need to work and have an intersectoral convergence to make sure that we are working for a greener practices for this world. So there's no one point solution for the climate. It's something amalgamation of multiple actions and policies which need to be working for making sure that we deal with this.
Thank you so much, Bhavneet. One last question, because I see we should be closing at the hour, but then I also think this is also quite useful for us to help Kamau with. If found in spaces where fellow leaders are competitive and bring each other down, what are some ways to maneuver around this?
I can come in very briefly. I think one of the things you can do, and I know I don't have a lot of time, the one thing that I've learned in Women Lift Health, that this is a group whereby we support each other. We do not compete with each other, as women especially. But if you are like in a workplace or in an environment and you find yourself in that situation, my advice would be the bigger person. There's room for everyone to coexist. Find out, why is that person being that competitive? Is it a superiority or an inferiority complex? How can you support them? How can you actually reach out and model that leadership that creates space for everyone to excel? Because there's room for all of us to do the best that we can do. And always remind people, why are you doing this? I always ask anyone who does that, why are you doing that? Why are you in that position? Why in this organization? The so what question. And again, for you, be the model, be the bigger person, and know that actually the more room you create for other people, the more opportunities will come out for you as well. I'll keep it brief, but that's my advice I could give for now. Thank you.
I'll just jump in a quick one. Just speak up. Speak up for those who are being put down. As a leader, we should find that in us to speak up for others who are being put down, male or female, and also engage. And sometimes in many environments, we find that still at the majority leadership is male. We have to learn to engage male allies. So male allies also speak up in such environments, so that it's always an environment where you're trying to build each other rather than break down each other. But if you are the senior most, you can't be quiet about that. As Lennie said, speak up, find out what's on the other side, but also speak for the person who is being brought down and bring up what it is that they do positively. Yeah.
Brilliant. And so with that, I would like to close and thank our panelists. I think the common theme of When Women Lead campaign is connecting before correcting. I think all the responses that you've given us is really that one theme, Bhavneet, that you gave to us, which was connecting before correcting and the importance of that. Really understanding that the journey is more than about the individual. So we heard a lot about how you involve our communities and bring them on with us. So it's about collective ownership and responsibility. And so when you're stepping in these roles, you really are affirming that the world's public health future is more than capable when led by women. So thank you so much, ladies, and really appreciate all the inspiration that you have shared with us. And I would love to also thank those who have joined us through the LinkedIn Live. Thank you for joining in. Thank you for participating. Thank you for summarizing, which really made my job easier because all the comments really summarized everything that was said by our panelists. And so thank you very much. And we hope to continue having more and more of these kinds of interactions. And until next time, thank you very much, ladies.
Thank you. Thank you. Thank you,
Thank
Akhona.
you. Thank you.
Wonderful.